Hi, this is LeJune with LeJune Singleton LLC, Fitness, Health, Nutrition, and Wellness Podcast. Today I'm talking with women's healthcare nurse practitioner, board certified Ashley Simone. Thank you for joining me today, Ashley.
Thank you so much for having me.
Can you give a background on who Ashley is?
So, Ashley is a women's health nurse practitioner. I did my undergrad at Towson University. So, I graduated as a registered nurse in 2013. And I went ahead to get my master's degree to be a women's health nurse practitioner in 2019 at Georgetown University.
And what was your decision to become a women's healthcare nurse practitioner?
My decision was really based on a lot of representation and education. I felt like there weren't a lot of providers that look like me, taking care of people that look like me. And I definitely wanted to represent that. And I love the part of education and health prevention. And I feel like a lot of people in our community, especially women, I feel like our bodies are so intricate and complicated at times, and we just don't have all the information or facts. So I really wanted to be that educator to the population, especially minority women.
Okay. And can you explain the difference in a nurse practitioner and a doctor?
Yeah, so a nurse practitioner is a registered nurse who has completed advanced training to take care of patients as far as diagnosing health conditions, managing care without the need of a doctor to be present. Depending on what state that you work in, you may require a co-provider, but fortunately, the state that I live in, I have complete autonomous care for my patients.
Okay. And why is it important for women to get physicals, and how often should they get physicals?
Women should be getting their physical exams every year, depending on different health conditions they may have that may require them to be seen more frequently. And so it's really important because a lot of diseases really may not possess any symptoms. Like hypertension is silent for the majority of people. And cardiac health conditions or congestive heart failure is a leading cause of death in women. And you don't just wake up one day with heart failure or cardiac health problems. It is a process, right? So you may start off with hypertension, diabetes, high cholesterol, and without being seen on a regular basis by your primary care provider, these conditions can go hidden for several years. So it is really important to be seen by your primary care provider and your well woman provider on a regular basis.
And speaking of cardiovascular health, what signs should women look for when it comes to strokes, when it comes to heart attacks, when it comes to high blood pressure? What signs should they look for to know immediately they need to be seen by a practitioner?
Yeah, so like I was just saying with hypertension, that the main symptom of that is no symptom at all,
Right.
unfortunately, until it gets to a point where it's really bad. And at that point, you may have a severe headache that's unrelenting, won't go away. You definitely need to be seen by your primary care provider. In some cases, even need to have urgent care at the emergency room, depending on how high your blood pressure is. When it comes to different heart conditions or like let's say stroke for instance, so you can have some numbness and tingling, you can have some visual changes, you can have slurred speech or the drooping of your face. So those are the types of symptoms you want to look out for when it comes to possible stroke symptoms. And when it comes to the heart attack, so women may be a little bit different. when it comes to heart attack symptoms as compared to the man. So men can typically undergo like that crushing chest pain, squeezing of the heart, feels like their heart's about to explode. However, so some women may experience this while having a heart attack, but other women may not. So symptoms for women could be possible like left arm pain or lower back pain. So the symptoms of a heart attack can be more vague for women as the typical crushing of the chest that men experience.
Oh, wow. And at what age should young girls or women go to see a gynecologist?
My personal belief is at the age of puberty. So that's typically around 12, 13. I think there is a lot of changes within our body that happen during that time. And it's really vital for good education for our young women to receive so they understand the different ups and downs that their body may go through. And I think that's also a perfect time to talk about sexual education as well. So the sooner the better, in my opinion.
And when it comes to educating on sexual health, is that something that you offer patients? Because sometimes parents, that's not a conversation that's had in the Black community about safe sex. Are you thinking about having sex? Is that something that you offer your patients?
Of course, of course. And I completely can understand why some parents may be uncomfortable having the conversation with their children about sex. I definitely think a conversation needs to be had. So if you are a parent and you are uncomfortable having that conversation, at least make sure they get in to be seen by a provider that specializes in women's health so they have the right adequate, correct information moving forward. That's very, very important. So that's something we definitely offer.
So, what tests or screenings are completed when patients come in?
Okay, so it can depend on your age range. So let's say that you're under the age of 40, we'll do, a breast screening where we do a breast exam, making sure that we don't feel any masses or any rashes, pain, skin discoloration. We'll also do a pap smear, which tests for or screens for cervical cancer. And
Mhm.
that all depends on when your last pap smear was it abnormal, was it normal? Okay. Above the age 40, then we'll start doing mammogram screenings every year to make sure that there's no indications of a mass or malignancy there. And we'll also do screenings above the age of 65 for bone density health, bone health, just to make sure you don't have any evidence of osteoporosis. And those are the big screen. For African American women, age 45, we do colonoscopy screening. So we'll give you an order to get a colonoscopy done. If you are not an African American woman, we start that screening at age 50.
Okay. And speaking of older women, most women feel that they don't need to come in when they reach a certain age. They're like, I'm not having kids. Um, I'm going through the change of life, as they call it, which is menopause. They don't believe that they need to come in. So why is it still important for them to come in? What are the risks if they don't come in?
Yes, so they definitely still need to come in. We are doing a lot of things at a well woman exam. So we call it a well woman exam or an annual exam. Um, and you need to get a mammogram screening every single year. So that's one reason why you need to come in to see us. We also, so we don't typically do a pap after the age of 65 if you've had no history of abnormal paps within the last 15 years, but we are still examining the vaginal tissue and the cervix just to make sure everything looks healthy. You can still develop, have some vaginal complaints at that age. So it's really important to come to see us just to make sure everything's okay. And then also, if you're having symptoms of menopause, like the hot flashes, the vaginal infections, or the dryness, things of that nature, you still want to see us too, because we have management options that we can go over with you, so you don't feel like you have to suffer through the transition.
And what are some of the management options?
So when it comes to, we call it vasomotor symptoms, so you have like the hot flashes, you may have irritability, insomnia. We really try to start with non-pharmacologic management first. So things would include making sure you wear layered clothing. So if you have a hot flash, you're able to take the clothing off. Making sure you sleep with a fan, that can really help, especially at night. If you have a hot flash, you can increase the soy in your diet. That can help. You can also try over-the-counter remedies such as black cohosh. All of those things can help when it comes to hot flashes. When it comes to insomnia, we may recommend trying to make sure you set a good sleep cycle for yourself, turning off electronics and light by a certain time. And then, after we try those things first, if it doesn't help, then we'll move on to possible medication.
And what is some of the reasons that women lose estrogen in their body?
So when it comes to menopause, so as we go through menopause, the estrogen decreases when we're going through menopause. So we lose our estrogen when we're going through menopause. There are different causes of hormonal shifts depending on maybe your diet or different chronic health conditions. So really, if you're ever experiencing symptoms of like hot flashes, irritability, new onset symptoms that you've never experienced before, it's important to be seen so we can check your hormonal levels to make sure everything's okay.
Because I know some women suffer from facial hair growth, chest hair growth. Is that from estrogen or is that from some other hormonal imbalancement?
Right. So that's actually from testosterone.
Mm,
So yeah, so we have estrogen and testosterone as women, but when we have higher levels of testosterone, then you'll experience some of that facial hair growth, male pattern balding. Some women may even experience enlarged clitoris. All of
oh,
those things can be related to a bigger health condition called polycystic ovarian syndrome, PCOS for short. So there's definitely medication management for that, most certainly. So if you're ever experiencing any of those symptoms, yes, schedule a visit with your OBGYN provider.
okay. And speaking of pap smear, we know pap smear has changed where it used to be yearly, now is every other year.
Mhm.
Why is the change?
Yes. So the recommendation has shown that between having a normal pap to, let's say, a full blown cervical cancer is about a 10-year time period. So, in someone who's getting PAPs on a regular basis and is being consistent with their PAPs, you're not going to really see any new changes. Or if you see something like, let's say, an ascus, atypical squamous cells of undetermined significance, then if you repap it later, then you'll most likely see it resolved. So with the recommendation, they're saying that between 1 to 3 years, there's not going to be that much of a change that's going to significantly cause detriment to the patient. So right now, currently, the recommendation is every 3 to 5 years, you need a pap smear, provided that your previous PAPs have been normal. And currently, I believe there's changes being made to that as well. So I'm going to a conference next month to find out more information about that. So I will definitely keep you updated.
So if a woman is experiencing some type of pelvic pain or something like that, they should immediately come in and not ignore it because I think one of the things, especially in African American community, we believe that we're supposed to have painful periods. So
Mhm.
can you kind of touch on that? And because we're, doing PMS time, we believe that, okay, well, we're supposed to experience this because it's normal.
Okay, so I just feel like us as African American women, we are so strong and resilient. And sometimes we have been conditioned to think that it is okay for us to be in pain and that pain is normal when it's really not. And you should definitely be seen for it. With menstruation, you can experience crampy, painful periods, most definitely. Some women experience cramping periods. We call that dysmenorrhea. Some women experience dysmenorrhea while others don't. Typically, if it happens, at the beginning of your period or a couple of days before your period, and you can manage it with maybe like an ibuprofen or a leave, then you're fine. What happens during menstruation is our tissue in our uterus plumpens, right? It builds up preparing for a pregnancy. The pregnancy doesn't happen, so that tissue pretty much dies and sloughs off. And that sloughing off is our period. So that degeneration and essentially the tissue necrosis, the tissue dying, that's where that pain comes in from. And so really what it's good to do is to take the pain medicine 2 to 3 days before your period actually comes, because that will try to cut off that inflammation cascade that happens. And that's really where you're getting the pain during menstruation. Now, if you're experiencing pelvic pain outside of having your menstrual period, that's definitely something that you want to be seen for. If you've never been the person to have crampy periods and then all of a sudden you start having really crampy periods, that's something you want to be seen for as well.
And as we know, also within the African American community, we are known for fibroids and cysts and things like that. Do you think it would be important for yearly ultrasounds to prevent that, or just for the patient to be proactive when they're having pelvic and back pains to go see a gynecologist or their primary doctor?
I think currently right now it's just important for the patient to be proactive. So if they're having any symptoms, any heavy bleeding, any pelvic pain, any severe pain during their period that just won't let up, even by taking I leave ibuprofen during a warm compress, it's debilitating. Yeah, be proactive and make sure you get seen. Fibroids definitely are more common in the African American community. I'm really not sure why that is, whether that be our diet. Definitely does have a genetic link to it. So maybe if your mom had fibroids, your grandmother had fibroids, you may be more prone to having fibroids. And so right now, there's no recommendation to have a yearly pelvic sonogram just to assess for fibroids or even to assess for ovarian cyst. There is no current screening for ovarian cancer. So that actually is something to think about. I don't know if in the future they'll require yearly or recommend yearly pelvic sonograms to assess for that. But right now that's not recommended. So I just say being proactive, listening to your body, getting seen right away when you first notice new changes within your body, that's what's important.
Okay. And what are some causes for women who have multiple periods within a month?
So it could be a hormonal imbalance. And sometimes that can happen because of your diet. Sometimes that can happen because of your exercise routine. Sometimes that can happen because of your thyroid hormone, depending on if you're having an overactive or underactive thyroid. And then also, if you have a history of fibroids, sometimes that can cause you to bleed longer as well. So there's a lot of different etiologies for having multiple periods in 1 month or bleeding heavy. So it's really important that if that is you, you are going to be seen by your women's health provider to get assessed for it.
Okay. And what are some causes of odors, discharge, UTIs, or vaginal infections in women?
Oh, that is like everything, right?
Right.
uh, so, I really believe that your diet, like the lifestyle that you live with your diet and your exercise, that affects a lot that goes on with our body. So, changes in your diet can also cause some vaginal health issues. So, let's say you're a person that eats a lot of carbohydrates, the breads, the pastas, the rices, and obviously like the sugary stuff, like the sodas, the juices, the candy. That may make you more prone to getting yeast infections. Yeast loves sugar, so you have to think about it like that. Someone who doesn't drink a lot of water can be more prone to getting urinary tract infections. I think it's really important to make sure that you know your triggers. Douching most definitely is a no-no. We should not be doing that. That can throw off your vaginal pH and make you more prone to getting vaginal infections. Smoking cigarettes, that's not good for any organ system, right? Let alone your vagina. So if you smoke cigarettes and you're finding yourself in the doctor's office consistently for bacterial vaginosis, vaginitis, you need to stop smoking. That definitely is a trigger. Wearing thongs can do it. Using scented soaps. So I just tell people a normal white bar original Dove, non-scented, most definitely. Sexual intercourse can throw off our pH balance and even sometimes cause urinary tract infections. Some women get urinary tract infections after sexual intercourse. So it's really important that you're practicing good sexual hygiene before intercourse, and you want to make sure you urinate before and after intercourse, most importantly after.
And is it important, especially after sexual intercourse, for a woman to wash up because basically that bacteria is just sitting there?
Right. So I definitely recommend urinating afterwards because that bacteria is on the urethra, and then sometimes that can travel up and cause a urinary tract infection. So urinating afterwards just to clear everything out and kind of clear that bacteria out, it's helpful. Like I said, I don't recommend douching. Sometimes though, if I do have a patient that has recurrent bacterial vaginosis, which is an imbalance of bacteria in the vagina, and they notice that sexual intercourse is their trigger, I do have some of my patients insert a boric acid vaginal suppository a couple of hours after intercourse to help maintain a normal vaginal pH.
Okay. And what about their partner? If their partner is not using Dove, does that matter when it comes to having sex?
To be safe, I tell my women patients, whatever you use for your vagina, he should be using for his penis. So that's Dove and Dove. I mean, if you think about it, all the germs and everything that collects on a penis before intercourse, that's all, I mean, during intercourse, that's all being transferred to you. So that's how I look at it. And it's just to be on the safer side, just stick with Dove and Dove.
So, what would you suggest for women to maintain a healthy pH balance?
I recommend that my patients take a probiotic. I definitely think that helps with the vaginal flora as well as gut health too. I think that's amazing. I recommend that you don't douche, you don't smoke cigarettes, you don't wear tight fitting leggings or jeans consistently, because if you think about it, bacteria likes warm, dark, moist environments. That is our vagina all day, every day.
Right.
And so any little thing we do can tip the balance to whereas we have more bad bacteria than good. And that's essentially what bacterial vaginosis is. So making sure you don't use scented soaps, you don't take frequent bubble baths, you're practicing good sexual hygiene. I think all of that is important. You're eating a nice, well-balanced diet, all of that.
And speaking of that, typically when women work out, they go run errands afterwards. So is that the ultimate no-no?
Yes, I say no, don't do it. Don't do it. It's like a petri dish that for bacteria that you're just collecting. So as soon as you work out, I mean, as soon as you're done, you need to change your underwear to a clean pair of cotton underwear. Cotton underwear, and that's another thing that I recommend too. Cotton underwear only because it helps with moisture.
And should women sleep with underwear at night or no?
No, let the girl breathe. You've been like suffocating her all day long, at work and running errands. At night, just let her breathe. No underwear at night is what I recommend. Unless you're on your cycle, that's a whole nother story.
Yeah. Okay. And speaking of cycles, as we know, it's the new trend of the menstruation cups. So is
Mhm.
that better than tampons or pads?
I can't say that it's better. I feel like with both of them or with any method that you choose, you have pros and cons. So I think that if you are a person that wants to go with the more holistic route, the more natural route, then the menstrual cups are good for you. If you're a person that has been wearing pads and tampons all your life and haven't had an issue, I think that it's fine for you to continue wearing them.
And how long should a person wear a pad or a tampon throughout the day before changing it?
So some of them are, well, when it comes to the tampons, I would say 4 to 6 hours. Um, on the box, whatever box that you brand that you have, it should say for how long that pad or tampon is suitable for. So it's really important that you read that and you abide by that, because when it comes to, especially when it comes to tampons, you can have something called toxic shock syndrome, and that is an infection that's very dangerous, and you don't want to get that. And you get that if you have a tampon in for a prolonged, extended period of time. So it's really important to check those labels.
Okay. And why do women have issues with leaking when they cough, laugh, or sneeze?
Yeah, so leaking of urine when you cough, laugh, or sneeze is called stress incontinence. So it has to do with the pressure that's exerted when you are doing the coughing, laughing, or sneezing, and the stability of that pelvic floor muscle. So women who have a weaker pelvic floor, that can be women who are older in age or women that have had multiple pregnancies. Their pelvic floor muscles may just be a little bit more weak. And the first thing I typically recommend for that is Kegel exercises. And the best way I can describe how to do a Kegel would be like if you were urinating and you tried to stop the urination midstream. That's kind of what doing a Kegel feels like. And you want to do it, you can do it multiple times throughout the day. And it's about the length of time that you hold it for. And so try just holding it for 10 seconds and see how you do. And try to keep it up and go longer and longer if you can. They actually make Kegel balls that you can purchase like on Amazon and different health stores to help you practice your Kegels, most definitely. But if you feel like this is a situation, it doesn't get better with Kegels, it's getting worse, you definitely need to make an appointment with your woman's healthcare provider.
And as we know, the latest trend is the yoni balls and the yoni steams. Would you recommend that for your patients? Why or why not?
I I can't recommend that for my patients at this point because our leading board that governs, how we practice, the American Board of College Obstetrics and Gynecology, um, they there's not enough research. There's not enough research to really say one direction or another. However, I can say that I do have patients that have done the Yanni steams and it's worked for them. I've had patients that have done the Yanni steams and it hasn't worked for them. So
Um,
I just need to see research and I need more research to accurately and without a doubt recommend it to my patients.
Well, I know some women do it who have issues with infertility. What do you recommend for women who suffer infertility, and what are some of the causes for infertility?
So there's a lot of causes for infertility. It can be your age. It can be if you've had frequent STDs in the past, if you've had particular GYN procedures that have led to it. I definitely think that you should be seen by an infertility specialist. So typically we would recommend people to Shady Grove Infertility. So infertility in someone who is younger than the age of 35, younger than the age of
Mhm.
35, is considered 1 full year, after 1 full year of actively trying to conceive, not being able to do so. And if
Okay.
you are at the age of 35 or above, that time frame decreases to 6 months. So if you're
Mhm.
a person that has been actively trying, and what I mean by actively trying is you are tracking your ovulation days, you're tracking your periods, you're making sure that you're having intercourse on those days that you're ovulating, and you're still not being able to conceive, you need to be seen.
And women who have long-term partners, I'm sure you get them in because I used to work at the health department, who I'm sure you asked, hey, do you want to be tested for STD? What signs and symptoms should they look for, and why is it important for them to get tested?
That is such a good question because I get that all the time. No matter your marital status, single, married, divorced, other, if you are sexually active, I'm asking you, do you want an STD test? And it's so funny when I have my patients that have been married for 20 years or have been in a monogamous relationship for 5 years, and they're like, oh, I'm good. And like they just kind of brush it off, or they laugh at me for asking them such a crazy question in their opinion. And I'm just like, it doesn't, I mean, I think that it's very important for us women to be accountable for our health.
Right.
And I think getting STD screening is one way that we can be accountable for that, especially because a lot of STDs don't really have symptoms.
Yep.
And so how, if you're in that population that doesn't experience symptoms, how do you know that you don't have one? You don't unless you get
Right.
tested. So that's something I definitely recommend and that I offer my patients. And if you say no, that's perfectly fine. That you have every right to say no, especially if you feel like you don't need it. But that's definitely something that you're at least going to get offered.
And definitely with syphilis, because syphilis has no signs and symptoms.
Hmm.
It doesn't hurt, and it could be a body rash, and most people are like, "Oh, it's eczema. How do you know it's eczema?"
Right, right. And
Um,
syphilis is on the rise too. It's
yeah,
crazy.
it's on the rise. It can, alopecia. It's just like crazy normal signs that people are like,
Hmm.
okay. So that's definitely important. So definitely, please, if you got a rash, please go get tested, because if you're having sex with somebody, it could be syphilis. I'm just letting you know. I saw a lot of the numbers, and I'm sure you have too.
Yes, yes, yes. No, I completely agree. I just feel like if you're experiencing anything with your body that is new, you've never experienced before, you don't know what it is, please just don't assume. Like, go get it checked out. Even though it may be something simple as it could be eczema, right? It could be, but you
Right.
don't know that for sure because you haven't gotten it checked out. So please just do your due diligence and get it assessed.
Yeah. So speaking of sex, as we know, most places hand out male condoms to women, which, I don't really agree with, because the chances of a woman, or especially a young teenage girl, saying to her boyfriend or a guy she likes, hey, can you put this on, for the risk of him possibly saying, no, I'm not putting it on. So, what do you say to those patients that come into you?
I really recommend that all of my patients before they enter a new relationship, or not even before they enter, let's say they're in a relationship, they're dating someone, before they make that next step and become sexually active with that person, I recommend they both get STD testing. So they know what they're entering the relationship with. They know what they have, what the other person has, and how to act accordingly. I think knowing your status is very important, and that's another way to be proactive and accountable for yourself, especially if you're going to be realistic and, not look to or remember to use a condom.
And what should women look for physically as we age? Like,
So as you age, just being mindful that your body goes through a transition. And so things are going to be different. And that's okay, though. That's okay. I don't want women to feel like they have to suffer through going through the change and aging. I definitely feel like that's something that we should embrace as women. And I think one of the ways to help us be more comfortable embracing the new changes when it comes to aging is knowing what you're up against. So definitely schedule an appointment with your women's healthcare provider or even your primary care provider so they can educate you on things that are normal within aging. So, you're, especially if you're a woman after menopause, your bones may be a little bit more brittle. So you want to make sure you're taking calcium and vitamin D and doing weight-bearing exercises. Your thin elasticity is decreased as you age, and that is normal. Making sure you're drinking a lot of water, you're staying hydrated too, being mindful that medications may move more slowly through your system. So you definitely don't want to take too much, especially something that wasn't recommended by a doctor or a healthcare provider. Being mindful that your metabolism is going to be a little slower when you're aging. Okay. So the easy amount of time that it took you to lose 10 pounds when you were younger is going to take more effort from you now that you're older. And that is okay. You just have to put in the time and you'll be fine.
okay, that makes sense. And how do you balance career and your personal time?
That's a good question. I am working on it currently. I'm a fairly new women's health nurse practitioner, so I jumped out the gate just wanting to give my all to patients, like 100%, thinking about patients and doing stuff involving my patients, even on my off days. And I'm realizing that I need to scale it back,
Yes.
because the only way that I am going to do what I love to do and not have any resentment is if I have a good balance. So I think that right now, so what I've tried to do and made changes on, instead of like working on patient stuff during the weekends, my weekends are for me. I do whatever I want in the weekends, and that includes, just hanging out with my family and just relaxing, catching up on anything that I didn't do in that following week.
Okay. And what does health, nutrition, and wellness mean to you?
Health, nutrition, and wellness means being proactive about your health. It means being consistent with trying to lead a healthy and active lifestyle.
Okay. And how have you stayed positive and motivated during COVID-19, especially with your patients and being new in your position?
Yeah, so luckily for me, I started therapy when I first started the job, not because I feel like I need therapy, but like I believe it when I say prevention is key, to be proactive is key. Um, I knew that I was starting a new role. I didn't want to have a moment where it was like I felt like I was stressed with no way out. So I was like, let me just start therapy. I'm feeling great now, but let's just start it so I can have the tools that I need for if just in case I was ever in a moment where I felt stressed and needed an outlet. So
Mm-hmm.
I definitely think going to therapy helps. I am a woman of faith. And so I think my relationship with God has also helped me push through this COVID-19 times. And then my colleagues are just flipping amazing. They're, oh my gosh, everything I could have wished for in colleagues, especially starting out this new advanced practice role. So all of that in combination has made a really good COVID-19 time for me, actually.
And how can anyone reach you for services? Are you only in the Maryland area or?
Yes, so I practice in the Maryland area. I work with MedStar Medical Group. And so they actually have several locations, but the particular practice that I work at is the Clinton and Waldorf location. I rotate between both offices. So you can definitely call the office, or you can even go online. I believe it's medstar.org, and you'll be able to find all of the contact information.
And is there anything else that you're working on during this COVID-19 time, or are you just focusing on your new role as a nurse practitioner?
I'm mainly focusing on my new role as a nurse practitioner, but recently I have been given the opportunity to try to make some policy changes when it comes to maternal health outcomes in DC. So I'm looking forward to what that may bring me.
Oh, wow, that's cool. Definitely will have to have you back on that topic because
Yeah.
I think that is, one of the major concerns when it comes to women and the treatment of especially Black women's health. And that was actually one of the questions I got from someone is how can you be proactive when you're in a doctor's office and they're ignoring what you're saying? So what can you do?
Most definitely. That's such a good question. I think that doing your research is very important. I typically I don't recommend Dr. Google, but like there's websites like acog.org or nih.gov or cdc.gov. Those are really good, reputable websites where you can find information about whatever you may be going through. And when you go to your visit, tell them, like, let them know, hey, I was on this website and I read here this, this, and that. Or I'm feeling this symptom. When I looked on this reputable website, it said this, this, and that. I think that a lot of times, especially as African American women, our needs and concerns get overlooked or not taken seriously. And I think that we just have to let them know, like, hey, I've done my research. Like, this, I don't care if it's little to you, it's something to me. And to be unrelenting about it, to be adamant about it, to be consistent. Don't give up if you've received a no from someone else, or oh, you'll be fine, see you in 6 months from someone else. Go to the next person. I think it's just consistency is key as well.
Okay. And I think for especially the African American community, I think most of us get kind of afraid to say anything because we look at a doctor or a nurse practitioner or a nurse as so educated and we don't know what we're talking about, and it's that fear. So I think you saying that, being on that other side of saying speak up for yourself is definitely important. I thank you for that.
Yes. And even if you feel like, hey, I think this may be it, but like, I'm not sure, I want you to say it anyway, because you may not be wrong. You may not be wrong. And that just opens dialogue for more education and, you know, definitely more education. I think that's amazing. And if you have any questions about your health, I think you need to write them down. Write down your list of questions before you go into the doctor's office. Bring it with you so then they'll be able to be addressed. I think that's also a good point too.
Well, I definitely thank you for your time, and this was definitely some good information, especially for us women of color, because we do have questions. We're, told or not told because the conversation is not had in our homes about sex, about your period. You just, try to figure it out in this life.
Right,
But
right.
so I and it actually, when it comes to sex as well, you try to figure it out. You don't know because it's not a conversation had. So I thank you for talking on those topics. I would definitely love to have you back. And I'm sure it's going to be more questions from other people. So thank you, thank you, thank you.
Yes, thank you so much for having me. I definitely want to be an educator and an advocate for women. So please, if any of the listeners have any questions about women's healthcare, you can definitely ask me. I'm on Instagram. You can find me at CHEIDI21. Shadi 21 is how you pronounce it. And I am so open to educating my fellow women, especially minority women, about health, because I don't think it's something that we should guess or not know. I definitely think it's a conversation that needs to be had. And that's what we're here for, to give you that information so you don't have to go through this alone or go through this without knowing what to expect or anticipate. So definitely reach out to me, and I would love to come back for another one.
Speaking of that, I know a lot of people come into the doctor's office and they're not 100% honest about their partners or them having sex or some experiences, that pain and things like that they're having because they just want to in and out process. What would you say to them?
An in and out process at what cost? You know what I mean? I think
Mm,
the only way that us as healthcare providers are going to be able to care for you to the best of our ability is if we have the information. A good history taking is almost like 50% of how a good visit should be conducted. So, and like how we manage and develop your plan of care. So, when we ask you those questions about your history or about what symptoms that you are suffering from or experiencing, it's really, really vital that you give us the information, no matter how embarrassing it may be. I promise you, we've heard it before.
right.
You are not the first patient. Like, honestly, I don't think I've heard something that's ever surprised me. Like, it really. And as women, we go through so much, we experience so much that you're not the only one. It feels like you are because no one likes to talk about it, but that's what we're here for. Like, I want to talk about it. Let's talk about it.
Okay, well, definitely thank you for that because, I hear that a lot, especially when I worked at the health department, people would come in and you would ask them about their sexual partners and they would lie and say, oh, well, I only sleep with women or I only sleep with men. And then the tests come back positive and it's like, okay, well, can you provide the, names of
Yeah.
your partner or partners?
Yeah.
And they're like, I was like, hey, what's the lady's name? Or hey, what the guy's name is? And it's like, oh, well, no, I only sleep with men. Or no, I only sleep with women. Like, why didn't you tell me that when we were face to face?
Before. Yes,
But I
yes,
guess,
I know. It's an embarrassment factor, they don't want to disclose that, which I mean, I can understand, but they're really doing themselves a disservice at the end. Like, we can't care for you properly if you don't give us all the information. And then it becomes a situation where it's like now you're tracking the person down, trying to get the
right,
correct information. It's like
right.
you should have just started off there from the beginning. It would have saved us a lot of time. Um, but yeah, it's something that we're consistently going to have to just work through. And I feel like the more that we make our patients understand that they can trust us, right?
Mhm.
Once we do that, then I'm hoping that problem will decrease.
Well, again, I thank you for your time. I definitely want to have you back and thank you.
Thank you so much.
All right, bye.